muscle when it is extended, where it will come? Humerus. Forward. What is this? Flexion at the shoulders. So shoulder joint is the best example of the action of muscles. Very clearly all the movements of the joints. You will study the hip joint also, knee joint also, ankle joint, so many joints. But shoulder joint is the best for, because all movements are possible in the shoulder joint. It is a multi-axial joint. You can move the arm in any direction, anywhere. No such joint is present in the human body. It is a unique joint. You can move it in the any direction. It's a multi-axial joint. So that is the action, how to understand. Adduction, medial rotation, and flexion also if arm is extended, that you have to write down. Because there are other flexors out there. And this is not the only adductor. There are so many adductors. It is not the only the flexors. So many flexors are also present. So all the muscles, they act in union to bring about the certain movements at the shoulder joint. So that is the pectoral spleen. Second muscle we will do the pectoralis minor. As the name suggests, it is a minor. It is small. Bacha, chota. So that is called pectoralis minor. So we are from a origin, number one, heading origin. Remember third, fourth and fifth ribs. 3, 4, 5. 345. From three muscles. Ribs. Third, fourth and fifth ribs from its outer surface. Nearly anterior to it. So from here, origin of this third, fourth and fifth ribs near the outer surface, the pectoralis minor goes upward and it is inserted on the coracoid process, which is a comma shape, hook shape structure on the anterior aspect of the scapula. This is the coracoid process. So it is a parrot beak-like projection, like the hook like this. From the subscapular fossa, this raised area, this is called the coracoid process. So this muscle will be inserted over the coracoid process on its medial aspect, leaving the tip of the coracoid process, which lies laterally. It is only inserted on the base of the coracoid process or on its medial aspect. Origin insertion. What is the action? Contract the muscle. What will move? Coracoid process or scapula. In which direction? Downward. So what is the action? Downward point of the scapula. Downward point. So it pulls the scapula downward in position. So when it pulls the scapula, naturally the glenoid cavity also will go down. The shoulder joint will also go down. So this is the action. Pectoralis minor. Bringing the point of shoulder, point of shoulder downward, that is the action of pectoralis minor. Now it is this medial border, this is the lateral border of the pectoralis minor. Then comes the anterior surface of the scapula, this is called the subscapular fossa. And a big muscle is taking origin from this is called the subscapularis. So subscapularis muscle taken from the anterior surface. And from here this muscle comes and it is inserted on the lesser tubercle viaduct. Lesser tubercle is only having one muscle insertion. Lesser is small, greater is big. So greater three muscles sit, but for lesser only one muscle. Subscapularis. This muscle is inserted on the lesser tubercle. What will be the action? Scapula is behind, humerus is in front. So when it comes, where the humerus will go? Backward. That is the extension. Backward movement is called the extension of the upper limb. As it is lying on the lesser tubercle. So when this scapula will contract, what will happen? There is a slight medial rotation of the humerus also. Medial rotation. So that is this is the medial rotation. This is lateral rotation. So when the head of the humerus moves in the glenoid cavity, the medial rotation is done. That is medial rotation. Then the fourth muscle is subclavius. We have already done subclavius. Sub is below, clavius means clavicle. So below the median end of the clavicle, and from the first rib we have done which muscle taking origin? Subclavius. And where is the insertion? Subclavian groove below the clavicle. This is subclavius muscle. One more muscle. Fifth muscle is the serratus anterior. Serratus anterior muscle. The serratus anterior muscle takes about 8 points from upper 8 ribs. Which surface? Outer surface of upper 8, from first to 8 ribs. And the origin is like the fingers. They are called the 8 digitations. Fingers are called digits. So this muscle is called digitation. So first digitation you have already done with the thorax. What is attached to the outer surface of the first rib? First digitation of the serratus anterior. From its outer surface. Same the outer surface of second rib, third rib, fourth rib, fifth, sixth, seventh and eighth. From everywhere, what is muscle is taking? Digitations like the fingers, and where it is going? Along the curvature of the rib posterior. So muscle also curves around like the ribs. And all the 8 digitations goes posteriorly, and all are fused, and they are inserted from the medial border of the scapula. From its superior angle up to the inferior angle. So this is how the 8 digitations go. Backward. So what will be the action? So when the first digitation from the first rib will be inserted on the medial anterior surface of the medial border of the scapula from the superior angle. So this is the medial border. So here is this is the medial border. This is the anterior surface of the medial border. This is the posterior surface. So anterior surface, first digitation of serratus anterior. 1, 2, 3, 4, 5, 6, 7 and 8. From superior to inferior angle, whole of the serratus anterior muscle is inserted over. So what will be the action? So whenever this muscle will contract, where the scapula will move, in which direction? Forward. Forward direction. And where lies anteriorly? What lies? Ribs. So scapula will be touching the 8 ribs. That is the action, that it approximates the scapula with the thorax, or it fixes the scapula with the ribs. Even you can see impressions of the ribs are also present. These lines you are seeing on the subscapular fossa, these lines are made by the bony ribs because it touches like this. And serratus anterior muscle is acting in all movements around the shoulder joint. Because scapula has to be fixed. Only then the humerus can become multi-axial. This has to be fixed. If it is moving, then it is not possible. The serratus anterior is taking it from upper 8 ribs. So whole of the medial border, anterior surface is occupied by the insertion. Because scapula is triangular in shape, 3 angles, superior, inferior and lateral angle. Lateral angle is expanded that called glenoid cavity. This is the angle actually. So that is how you do. So this is the 5 muscles we encounter in the pectoral or the front region of this. Origin, insertion and action of all these muscles we have done. Now all the muscles they require the nerve supply. So nerve supply we do.